Namaste. I am Dr. Neeta Verma. I am working as a urologist in Ahana Gynaecare. Today we are going to talk about a very common topic which is common among females and males both, that is urinary tract infection. So, urinary tract composes of all the parts: kidneys, ureter, urine bladder, and urethra. So, in चारों में से किसी भी organ का when we have an infection, we call it as urinary tract infection. We usually divide it into simple and complicated. तो कोई भी infection अगर पेशेंट का खाली ब्लैडर और यूरेथ्रा तक कन्फाइंड है, देन वी कॉल इट एज अ सिंपल इन्फेक्शन. बट अगर यही इन्फेक्शन हमारा यूरेटर या किडनी में पहुंच जाता है, देन इट बिकम्स अ कॉम्प्लिकेटेड इन्फेक्शन. सो in males and females, both are very much predisposed to this kind of infection, especially after they cross certain age like 40 and 50. In females, after menopause, this becomes a very common problem. मेल्स में दिस इन्फेक्शन इज नॉट सो कॉमन, बट जब भी मेल्स में इन्फेक्शन होता है इट इज कंसिडर्ड एज कॉम्प्लिकेटेड इन्फेक्शन. दैट इज वाई वेन एवर मेल्स गेट दिस यूरिनरी ट्रैक्ट इन्फेक्शन, दे शुड इमीडिएटली कंसल्ट अ डॉक्टर. Now we are going to discuss about the causes of urinary tract infections. Urinary tract infection can either be caused by simply because of the environment when you are peeing in, and other causes are patients who have diabetes or who are immunocompromised. They are more prone to this kind of urinary tract infection. When you have any kind of anatomical abnormality, जैसे आपके किडनीज में स्टोन हो जाता है या मेल्स में ब्लैडर एम्प्टिंग प्रॉपर नहीं होती, इवन इन फीमेल समटाइम ब्लैडर एम्प्टिंग इज बिकम्स अ इशू. दे आर नॉट एबल टू पास यूरिन कंप्लीटली फ्रॉम देयर ब्लैडर. देन व्हाट इट कॉजेज द स्टैसिस. आपका यूरिन का स्टैसिस हो जाता है यूरिन ब्लैडर में, एंड whenever there is a stasis, there is a chance of bacteria to flourish. So these are the causes that are very commonly associated with urinary tract infections. Now we will talk about usually what kind of investigation we usually order during urinary tract infection. Whenever patient comes in, they complain कि उनको urinary frequency हो रही है, that means उनको बार बार यूरिन जाना पड़ता है. Burning and pain during passing urine. दैट इज अ वेरी कॉमन प्रॉब्लम. कई बार फीमेल्स एंड मेल्स जिनमें ब्लैडर एम्प्टी नहीं हो पाता, दे कंप्लेन ऑफ लोअर एब्डोमेन पेन. उनके लोअर बेली में अम्बलाइकस के नीचे काफी पेन होता है. समटाइम्स when this is ignored, they get fever also, and whenever it is associated with fever, then it becomes a little bit complicated. Patients, they must go to the doctor, because then that means it is involving your kidneys. It can be involving your kidneys, so it has to be treated promptly. The patients आते हैं, we take history, we see whether they are diabetic, immunocompromised और कोई उनकी disease है कि नहीं है. उस basis पे हम लोग investigation order कर सकते हैं. We order urine का routine examination, culture, ultrasound to see if there is any anatomical abnormality in the kidneys or in the bladder, and accordingly उनका treatment होता है. Based on urine routine and culture, we prescribe antibiotics to the patient. And अगर हमको कोई predisposing condition मिलती है which is prominent like kidney stones, and then ultimately after treating the infection, we have to treat the cause of the infection. So that is one thing. दूसरी चीज, इन फीमेल्स when this is an infection in old age, we have to determine what is causing the infection, because after menopause there is changes in the vaginal pH which predispose these women to cause different kind of urinary infections, and then we have to treat it accordingly. उनकी pH change है, we have to see how we can improve it, how can we improve the hygiene, what measures we can take in everyday life to prevent urinary tract infection. First and most common, I will say, that to keep proper hydration. The more hydration we do, the more flush out of the toxins and the bacteria from your urinary bladder. First and foremost important thing is hydration. Second, I will say that we should always pee at a position in a place where it is clean and hygienic. Otherwise, it will predispose you to infections. And third, whenever you get symptoms, you should go and see the doctor so that they can prescribe you appropriate antibiotics and do the further investigation to rule out any serious cause which is causing infections again and again. Thank you.